Hi, I'm Dr. Craig Sawchuk, a clinical psychologist with Mayo Clinic. After 25 years of meeting with patients of all ages and backgrounds, I'd like to share some information about a behavioral condition called non-suicidal self-injury or self-harm. Self-injury is doing deliberate harm to your own body, like cutting or burning yourself, and it's more common than you might think. In a recent year, self-injury led to over 300,000 emergency room visits. Most often, self-injury is a way to use physical pain to distract from emotional pain. It may be done to try to get some sense of control, or relief from intense urges or emotions, or to punish yourself for perceived faults. Even if suicide is not your intent, self-injury can be serious, or even fatal. Getting help now can teach you or someone you care about much healthier ways to cope. There are some emotional triggers for self-injury to be on the lookout for, starting with difficulties in your personal relationships. Also, if you're struggling with strong emotions or feeling helpless, hopeless, or worthless. Here are some of the most common signs of self-injury to look for in someone you care about. Fresh cuts, scratches, bruises, bite marks, burns, scars, often in patterns. If a person constantly keeps sharp objects on hand, wears long sleeves and long pants, even in hot weather to conceal their injuries. Many people self-injure themselves only a few times and then stop. But for others, it can become a repetitive and dangerous long-term behavior. The urge to engage in self-harm can be hard to control. If you're injuring yourself, even in a minor way, or if you have thoughts of harming yourself, reach out for help. Any self-injury is a sign of things that need to be addressed. Even though it might feel embarrassing or difficult, start by talking to someone you know and can trust, like a friend, healthcare provider, spiritual leader, school counselor, nurse, or teacher. Ask them to help you take the first step to get the supportive, non-judgmental care you need. If you think you may hurt yourself or even attempt suicide, call 988 now. It's free and confidential. If you're severely hurt or it's an emergency situation, call 911 immediately. If you have a friend or family member who is self-injuring, the discovery can be a bit scary or shocking. Here's some ways you can help. Express your concern, but be calm and avoid making accusations, threats, or ultimatums. For your own child, consult their pediatrician or healthcare provider to help them get an initial evaluation or a referral to a mental health professional. If it's a young friend of yours, suggest that they talk to their parents, a teacher, school counselor, or trusted adult. And for an adult, it's best to gently express your concern and encourage them to seek medical and mental health treatment. Self-injury is simply too big of a problem to ignore. You don't have to deal with it by yourself. Take the next step and reach out. We wish you well.